been offering SLT for years for my patients. I've been using it ever since I talked to Mark Latina about it, who was pretty much the first person to help come up with the idea for it. And I found that the SLT offers a very good option for our patients. And over the years, I'd say I've treated hundreds of people, I don't even know how many, with SLT. And I've used it anywhere from kind of early in the spectrum to later, depending upon the patient's needs. But I found that the SLT has offered a great option for our patients. One of the things we're facing nowadays is the cost of healthcare. And there was an interesting article done just in April of 2012 in Archives of Ophthalmology by Sider and Associates. And what they did is they took a look at how much does it cost us to take care of a glaucoma patient. So they took an analysis of a small bottle for once-a-day medicines and a large bottle for 2 or 3 times a day medications. And they looked up the price out of the Red Book, which is kind of the standard textbook to look up the cost of medications. And they said, okay, if you're using these over a period of time, what does it cost us if you look at the wholesale cost of that? And then let's compare that on the other side with the cost of SLT. And what they did is they took SLT and figured out what the kind of the median or maybe it's mean reimbursement was for lasers across the country according to Medicare. And then they assume there's going to be some costs tied into having laser. One might be that you have to use an anti-inflammatory in a few of the patients. Maybe some of the patients might need some timolol for a short period of time to prevent pressure from going up. But it was looking at early intervention. And they said, okay, if somebody's going to come into your office and they might need a laser done, or they might need medicines, and we go down this pathway one way or the other, what's it going to cost us down the road? And look at that to see how that adds up. And what they found is that somewhere between about 6 months and 38 months, you cross the threshold, depending upon the cost of medications, by doing SLT. So what it showed us that SLT is more cost effective at a minimum 6 months, and the maximum at 38 months if you have generic timolol. So it seems to show us that the cost of SLT amortized over time basically saves you money for the patient care, as far as a global cost for them, for their health care, anywhere from roughly 6 to 38 months. So SLT offers us a way of reducing the cost to the patients. Out-of-pocket cost for a patient to have laser is fairly low, but then the advantage is once that happens, they may not need the added cost of medications or what current costs they'd had or anticipated costs they'd had for medicine, so that takes that away. So their upfront money is maybe slightly more than a few months of medications, but in the long term, they save the money with it. So, but with somebody who has incorporated SLT in their practice as far as a physician, what they experience with using it is that the reimbursement is roughly in the range of a few $100s. If you take a look at the average person with glaucoma and you're trying to decide, the things I think that you want to stay away from is anything that potentially could irritate the eye or make the patient not happy with their care. And medications sometimes have side effects of redness, preservatives, which may irritate the conjunctiva long term. And just the hassle of trying to remember things, the added stress that brings to people of trying to remember to put drops in. But certainly if they have the SLT done, it takes away some of the anxiety about the whole thing. So I think one hidden benefit of SLT is both the physician and the patient feel a little bit better about what's done, provided it works. And again, it does most of the time, but not 100%. And so I think the other thing that it does is it allows the patient to maybe have a little bit fewer visits during the year because the people know the pressure is controlled and you're not needing to adjust medicines as much. And the other real advantage is that it may provide pressure control different times a day better than medicines. Medicines seem to work, we get what we call a peak effect right after you put the medicine in, pressure drops, it wears off, and the pressure drifts back up. So what we see with this is that using the medication kind of has some pressure variance. SLT seems to have some variance, which we call a diurnal variance of the pressure, but it's more stable and stays under control throughout the 24 hours for patients. I think if you're first getting started with SLT, and it's a new thing for you in your practice, the things that you can look at to try to help you have a successful launch. Number one would be to decide that this is something you want to offer patients early on and not just necessarily later in the disease. I think doing that is a key element of it, because that's really one of the indications for SLT, and there's been good publications to support that. And embracing that allows you to have enough patients to really justify owning a laser to be able to do that. But it also changes the mindset of care. If you're only oriented towards medicines, then SLT may not fit in a practice, but if you're oriented that procedures might offer something for a patient, discussing that with them and those that want it, that it's appropriate for, you do that, and it seems to give the patients a better option down the road. But it's basically just deciding that that's something you want to embrace and talk about. And it's not necessarily just an add-on therapy for those people that things don't work. It needs to be more of kind of a central offering if that's what you want to do.